Hey everyone, welcome back to the channel. Today we're diving into a pretty important topic that touches all our lives, access to healthcare and how public health laws play a huge role in it. Ever heard of the Affordable Care Act, or ACA for short? Well, buckle up because we're going to break it down simply and see how these laws help us all, especially those who need it most. The Affordable Care Act. Key provisions. All right, let's kick things off by talking about the Affordable Care Act. This law, which was enacted in 2010, aimed to make healthcare more accessible to everyone. And guess what? It has some pretty big provisions. First up, we've got the expansion of Medicaid. For those who aren't familiar, Medicaid is a program that helps people with limited income get healthcare coverage. The ACA made it possible for more people to qualify for this help. Imagine a single mom working two jobs to make ends meet. Now she can get health care for her kids without breaking the bank. Next, let's chat about health insurance exchanges. Basically, these are marketplaces that help you compare and shop for insurance plans. Thanks to the ACA, families with lower incomes can get subsidies, which means they pay less out of pocket. More options and more savings? Yes, please. The ACA mandates that insurance providers cover essential health benefits like doctor visits, hospital stays, and even mental health services. This means everyone gets the care they need without being turned away for not having enough coverage. That's a win for everyone. Impact on public health outcomes. So how has all this actually impacted real human lives? Well, to put it simply, more people are insured now than ever before. Before the ACA, millions were left without coverage. Fast forward to now, and many of those folks are getting the health care they need, which leads to better health outcomes, simple as that. Also, let's talk prevention. Under the ACA, many preventive services like vaccinations and screenings are free. That means no copay, no deductible, just good health. Statistics show that people are using these services more, which helps catch health issues before they become serious. That's really important because, as they say, an ounce of prevention is worth a pound of cure. Reducing financial burdens on families. Now, let's dive into how these laws are making life easier financially for families. With the ACA, many folks are seeing decreased out-of-pocket costs. Imagine saving hundreds of dollars on monthly premiums. That's money that can go toward groceries, school supplies, or even a family vacation. A huge part of this financial relief comes from protections against discrimination. Thanks to the ACA, insurance companies can't deny coverage based on pre-existing conditions. So, if someone has asthma or diabetes, they won't be left in the cold when they need healthcare the most. This means fewer worries for families who may have been stressing over medical bills or, yikes, potential bankruptcy. Promoting preventive care for underserved populations. Now let's shine a light on underserved populations. The ACA has been a game changer for vulnerable communities. It focuses on improving access to care, especially in rural areas and among low-income families. One of the biggest helpers here are community health centers. These federally qualified health centers, often located in underserved areas, provide necessary services regardless of your ability to pay. So picture a small town where folks used to drive hours for basic medical care. Now they have a health center right in their neighborhood. That kind of access is life-changing. Challenges and criticisms of public health laws. But it's not all sunshine and rainbows. The ACA has faced its fair share of challenges. The political scene has seen debates and attempts to repeal it, raising concerns for those who benefit from it. Not to mention, some states opted out of expanding Medicaid, leaving many folks still uninsured. That's a tough spot, and it highlights that there's still a long way to go. Additionally, implementation hasn't been perfect. There are barriers that persist for some communities, like language differences and transportation issues, making it harder to access the services they need. It's clear that while we've made progress, we have to keep pushing for improvement. To wrap things up, we've seen how public health laws, especially the Affordable Care Act, play a massive role in improving access to healthcare. From increasing insurance coverage to reducing financial burdens for families, these laws are crucial for our society. But we also need to keep raising our voices for continued advocacy and improvement because everyone deserves access to healthcare. Let me know your thoughts in the comments below. And don't forget to like and subscribe for more insightful discussions. Until next time, take care and stay healthy.